Hi everyone, I want to welcome you to our hangout at City Hall the first Tuesday of every month. We bring in people from across the city to talk about key issues that are being discussed in the city and the surrounding area. Hanging out with this time around is Dr. Joseph Iser. He's the Chief Health Officer for the Southern Nevada Health District. Thank you, Doctor, for being here.
Thanks for having me.
And then we have Carolyn Leverage. She is the emergency manager for the city of Las Vegas. And maybe you're probably gathering what we might be discussing today. We're going to be talking about how our area is ready to handle in the event of an Ebola breakout in Southern Nevada and Las Vegas. Now you're watching us live, but we want to let you know that you can send us questions. You could just send them to #CityHallHangout. And when this hangout is over, a recorded version will be available at youtube.com/City of Las Vegas. So what do you say we get started? Because I know there's a lot of questions out there. Doctor, let's start with you. What do you think might be, I know there's many, but one of the biggest misconceptions when it comes to Ebola and how contagious it is?
There are a lot of misconceptions. It seems to be very contagious because of so many cases in Africa, but it's not very contagious. And I think that that's been shown by the number of people who have turned positive here in the United States. It's really been the two nurses that took care of a very sick patient in Dallas. And so part of the misconception is that it's very contagious. Another misconception is that it will impact us significantly. And I think that that's probably the one that I would like to alleviate some fears on. It's very unlikely that it will impact us to any significant degree here in Southern Nevada.
And both of you and Carolyn, is one of the reasons that it is not going to be impactful, I mean, as impactful, is because it's not airborne. A lot of people think it's airborne.
That is a huge misconception because it is in fact not airborne, which is part of what makes it so difficult to transmit. And a lot of people don't realize too that it can't be transmitted from one person to another if the infected person is asymptomatic, meaning not showing any signs of illness. So with that long incubation period, up to 21 days, a person can seem and appear to be healthy, and they are essentially healthy. As long as they're not showing the symptoms, they cannot transmit the disease. And that's really important for people to understand.
Well, and if that were the case, I think that people who were on these jets flying back and forth, we'd have a whole jet full of people who might have been infected. So how is it transmitted?
It's transmitted through bodily fluids. And that can be, for the most part, that would be vomiting or diarrhea, but there are other ways too. Certainly a healthcare worker is at great risk if they're using sharp instruments. So drawing blood, giving immunizations in a variety of ways. That direct blood-to-blood transfer, when you prick yourself with a used needle, is very infectious. But it's generally what we've seen in Africa is people who are taking care of very sick people, family members come in and they bathe them, they clean up the vomit, they clean up the diarrhea, or after someone has died, and then they're doing the same thing, they're cleaning the body, and that's a very infectious time.
Is it safe to say that it's transmitted in a similar way that HIV would be transmitted?
Yes, although HIV often isn't transmitted through vomiting or diarrhea,
right,
whereas this one is.
Okay.
But yeah, it's a bloodborne disease, much like HIV, hepatitis C, hepatitis B.
Okay, all right. And what are the symptoms? Because it seems to me as we enter flu season, everybody's going to get a fever and think, oh my God, Ebola. But what are the symptoms, and at what point do you go get checked to see if it's something more serious than flu?
Well, there are several sets of symptoms. So the first one is about 87% of people have a fever, and it could be as low as 100.5, which isn't very worrisome to most people. It can also be quite high. And then the first set of symptoms in the early stages are like influenza. So a lot of muscle aches, sore throat, a variety of other symptoms like that. It's in the end stages where we see a lot of the more worrisome symptoms, a lot of the vomiting, a lot of the diarrhea, and then organ failure and hemorrhage. It's one of 5 viruses that causes a hemorrhagic fever, but you don't see that until the end stages.
All right, so we're talking about misconceptions, and I know there's one that you would like to wipe off the map immediately, and that is how prepared we are here in Clark County, Southern Nevada, Las Vegas, in the event something should happen.
Well, I'm glad you mentioned the flu earlier because a lot of people don't realize, they don't understand that in Southern Nevada, you're at a much higher risk of actually contracting the flu than you're ever going to be at for Ebola, because it is airborne, it is more easily transmitted, and for most people, it may not have the same mortality rate, but if you're elderly or very young or already immune compromised, the influenza can be really problematic. And the sad thing is there's so much we can do about it. Get the flu shot. It's so easily remedied from the very beginning. Save yourself the trip to the hospital at the end of the day. So I just wanted to put that out there too, because a lot of people have a lot of fervor over Ebola, a lot of worry over it. The flu is that silent but deadly issue that we have too.
Something you should actually be concerned about enough to go out and get a vaccine.
Absolutely.
If there was a vaccine for Ebola, you'd go get it.
So preventable. Mm-hmm. But I'm glad you asked about our level of preparedness. I've had the fortune of watching Southern Nevada grow and over the years, and particularly our public health system grow in its response capabilities too. Not just infectious disease like Ebola, but a lot of the impetus was on bioterrorism after September 11 and the anthrax attacks. All of those things put a real emphasis on our nation's public health preparedness. And it has been amazing for me to watch our public health system grow up in that era and become so sophisticated. We have such tremendous professionals in our community who know how to interact in our incident command system, work really closely with our first responders, work really closely with our community. I feel very strongly that we have an exceptional system. So my compliments to you, Dr. Iser. I will be happy to let you fill in the details of everything that your organization's been doing.
Sure, thank you very much for the compliment. You've been in several of the meetings that we've organized. And we have had many, many meetings now for about 2.5 months. Our first one was with EMS providers and infection control managers at the hospitals. Subsequently, we've had 2 additional meetings with EMS to check the level of preparedness, to discuss any changes that have happened in the protocols. We've met with the hospitals. We've met with the emergency managers of the cities and the county. We've met with the hotel industry. We have another meeting coming up. And we continue to have meetings to get people prepared. I personally have done 3 briefings for top administrators and the school nurses with the schools. I have a meeting with the libraries. I think where people might be worried is about public venues, being in public venues. There shouldn't be a worry with that, but my goal is to alleviate some of the fear in the librarians, in the school administrators, in the school nurses. And I do think that we're very well prepared. I've listened into some conference calls from neighboring states on their preparedness, and I can say that we in Southern Nevada, I can't speak for the state or Washoe County, but we here in Southern Nevada are very well prepared. Could we be more prepared? Always yes. That's what exercises help us to do in real life events such as this.
And there have been a couple of reports that have lumped Southern Nevada into the state. And as you just said, we can't speak for the state, but we can speak for how prepared we are right here, because that's the area we're in charge of, and we are leaps and bounds ahead of many places. So that's something that ought to give everyone a little bit of relief, a little bit of relief. You kind of touched on this also, Dr. We are a tourism hub, and does that give us a special way of having to deal with this as opposed to a city that doesn't have as much tourism, so many people coming and going?
Absolutely, yes. But for other diseases, more than for this one, there are no direct flights anywhere to the United States from this part of Africa where Ebola has broken out. And so there are a couple of stops that people would have to go to get here. There are other diseases, avian influenza, SARS, and others that are in Southeast Asia, even MERS, which comes from Saudi Arabia and those countries, where I'm a little bit more worried because of the more direct flights that we have. But even in those cases, we're well prepared. The hospitals understand their duties, their responsibilities. EMS understands its duties and responsibilities. And I think we're well prepared for anything, any eventuality here. And I'll turn it back to you to see if you agree.
I absolutely agree with you. We had an opportunity to test our systems that long ago when we had an incoming flight from JFK Airport, which is one of the major hubs the doctor was referring to. that receives flights that are coming from West Africa. And this was the day before TSA started the new screening protocols at those airports. So when we heard incoming traffic from McCarran Airport of a flight coming in from New York with a very, very, very sick infant on board, and those symptoms sounded very much like Ebola, and the mother had a travel history near the West Africa region, it of course set off bells and whistles for us. And we went through the protocols that we already discussed amongst our responder agencies, between our dispatch center that was screening for the calls, our responders who were going to the airport to work with the county firefighters that are already stationed on site, working with Southern Nevada Health District and CDC, all in tandem together. We're able to get direct conversation with the mother of this child to find out more information about exactly where they've been and how they could possibly be exposed to Ebola, only to find out there was no link at all. Yes, indeed, the baby was very ill, and we transported to UMC for care for the child, but it wasn't Ebola. So we were able to provide reassurance to the other passengers on the flight, still educate them about what Ebola is, and if for some reason they felt symptomatic in some way, resources to follow up on it. Everything worked exactly to protocol. And that's just evidence of the professionalism that we have in our community, the training and the exercising that we've already done for these sorts of things. I'm very confident that we can manage incoming incidents very easily.
Well, and while you don't want anyone to be on a flight coming to Las Vegas with that sort of fear struck into you, in a way, it was kind of a good dry run. It illustrated that everything fell into place the way it was supposed to, the proper steps were taken, and everything
we treat all of these as the potential real deal. And when it turns out it's not, we're, thank goodness, but at the same time, you practice like you play. So we practice as if it's the real thing, and that way it makes us better for when we're faced with it.
And if I could add, is that, and I'm sure you'll agree with me, that every real life incident, and this was, even though it wasn't positive for Ebola, it was a real life scenario. And we learned from that, just as we would from every earthquake that we might have, every flood. We always learn something. Every tabletop exercise, every exercise we do with our hospitals, we learn something, and it improves our planning for the next incident.
Right. So hopefully we won't have any more of those incidents, but again, I almost hesitate to say, but it was a good test run for us, and I think the outcome was very positive and should give everyone a little bit of comfort. We all watched in Dallas the nurse who survived Ebola, who had been treating a very, very sick patient, when she was reunited with her dog, and it brought up the question, can animals get Ebola and transfer it onto humans? And I know, really, I mean, it's a good question. I mean, they quarantined that dog because they didn't know.
It's valid. It's valid.
Sure. Well, indeed, some animals can. There are 5 hemorrhagic fevers. They all live in probably a different jungle animal, and then for whatever reasons, they are exposed to humans. It might be that a bat was eaten by a primate, a monkey, and then the monkey was captured by someone in Africa. That's what we think happens in these outbreaks. And then during the slaughtering of the monkey, there would be some blood transfer with cuts on the hands. So indeed it does, but not in domestic animals like we see here. It would be in primates, monkeys, and other animals like that, and other wild animals like bats in this case.
Okay, so the King Charles Spaniel was safe probably, but still a precaution, just if for nothing else, to help everyone else feel safe and secure. So I guess bottom line, nutshell, if there was a real world situation, if something happened here, what would go in? How would the steps be taken? How would we respond?
Well, that's a good question, because there's a lot of focus put on the initial response effort, and I think there's this rush to bring a patient to a hospital. Ebola does not have to be responded to in that way. Really, the most important thing, if we have a strong suspicion of Ebola, is to isolate, right? We want to contain the situation and make sure that our responders are safe, and to make sure that we're providing the accommodations for the patient as much as possible. You know, I think Dallas gets a lot of knocks for how they handled certain situations, but given that there was no test case for this in our country, Ebola has always been a third world issue. Bring it to a first world environment and you're not entirely certain how it will react, right? Mass transit's not so much the issue in Africa as it is here. So there are a lot of unanswered questions or untested questions. We have a lot of great theory to back up what we think is going to happen, but until it's in the real world environment, you just don't know. But again, for us, it's isolating the incident, you know, protecting from any kind of contamination, and then providing the proper treatment is essentially what it boils down to. But we've had a lot of interesting questions come up as a result of what we saw happening in Dallas, particularly with the hazmat responses to the apartment, the decontamination that had to take place. All of those things raised a lot of questions in our community that we didn't necessarily have ready answers for. Questions about our water reclamation processes, questions about our sanitary sewer systems. What if we have a sanitary line bust downstream from a hospital that's treating a patient? So what happens to the workers responding to that line? Those are all questions that we've been talking about. We didn't have a reason to before. And so it's good to have this opportunity for these discussions because it just makes our planning stronger.
Any good final word you'd like to throw in there? I think people should be encouraged somewhat that the cases that have been here, aside from the one unfortunate gentleman who went to the hospital and then went home and then went back, they've all gotten better.
Oh, right. Well, and beyond
our medical system
right.
here is a little different than it is.
Right, and beyond the isolation and decontamination and everything, the health district has amazing capabilities when it comes to contact tracing.
That's correct. That's what we do every day of the week, even on the weekend. So someone with tuberculosis, someone with a sexually transmitted disease, if we have an outbreak of childhood vaccine preventable diseases, measles, mumps, rubella, we'll do the contact tracing and try to prevent further transmission. That's what we do. That's what we're prepared to do, among many, many other things. And so that's when we'll really jump into action to contain this disease or any disease.
And whenever there's something new to our area, there's just fear. I mean, we went through it with HIV and AIDS, and people thought if you shook someone's hand, you could get. And it's good to have discussions like this so that we can put a lot of those fears and misconceptions to rest. So I want to thank you both for being here, Dr. Einstein and here on Suffering. We also want to let you know once again that this hangout has been recorded and we're going to put it on YouTube. You can get to it by youtube.com/City of Las Vegas. And once again, thank you to you both. And we want to let you know that next month for our City Hall Hangout on December 2nd, former Mayor Oscar Goodman will join our current Mayor, Carolyn Goodman, for what I'm sure will be an unforgettable interview. Thank you both again, and thank you for being with us.
Thank you.